Hi, this is Zoe from Carepatron. Before you watch this video, don't forget to like and subscribe for more content like this. A nursing brain sheet, often called a brain, is an essential tool that nurses use to keep track of crucial patient information. This practical resource is typically a one-page document that offers a consolidated view of a patient's status, acting as a quick reference guide for nurses during their busy shifts. Think of the nursing brain sheet as your cheat sheet. It can include details such as the patient's name, age, diagnosis, medical history, specific care plans, medication schedules, test or procedures ordered, and significant lab values. This sheet also allows for real-time note-taking during doctor rounds or changes during a shift. Numerous studies have been conducted to establish the benefits of nursing brain sheets. A study published in the Journal of Advanced Nursing in 2018 found these tools significantly reduce communication errors during handoffs, enhancing patient safety. With this free PDF download from Carepatron, you'll have a ready-to-use nursing brain sheet template that you can customize to suit your unique needs. To use our free nursing brain sheet, follow these steps. Download our nursing brain sheets from the Carepatron platform, which you can find in the link in the description. Start with gathering the essential details of the patient. This includes their name, room number, age, gender, the admitting doctor, and assigned nurse. Track patient care. This includes tracking the patient's medical history, present illness, diagnosis, symptoms, and observations. Remember that any change in the patient's condition should be documented immediately to provide real-time updates. Lab results and radiology findings are vital in shaping the treatment plan. Ensure that these details are captured accurately for reference and ongoing treatments. Document medications and responses. Record any medication administered to the patient and note any side effects or reactions. This information is valuable for doctors who may need to adjust prescriptions based on the patient's response. Plan and deliver care. Outline the plan of care and any care given, noting the patient's response. Changes in the plan of care should be updated promptly. Record updates and changes. Keep track of any significant updates or changes in the patient's condition or treatment plan. It's also important to know other relevant information such as family visits or dietary consultations. Here is a sample of our nursing brain sheets, which you can find on our Carepatron platform. To find our nursing brain sheets, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.